Hello, I'm Michael Harper, and welcome to Riverview Medical Center's Sleep Disorders Center. These beds, this is our sleep lab. We try to make it look as comfortable as your home. These beds are 1,000-pound capacity, so we can handle patients of all sizes. Each room has its own bathroom, so patients don't have to leave the room in the middle of the night. They have their own bathroom. It's a private room. As you can see, we have the view of the river. We have flat screen TVs. We have a microphone in the ceiling so that our technologists can hear you if you need any help or assistance during the night. You're being videotaped with infrared cameras, so you're monitored throughout the night to make sure everything is safe and your stay here is comfortable.
So the first thing that I'm going to do is take a few measurements of your head so I know exactly where to place the wires.
Okay.
Then I'll rub each spot with the Q-tip that removes any dirt or oil from your face or scalp. I'll scoop some paste up an electrode. I'll put it down. I'll put a piece of tape or a piece of gauze over it, depending where it goes. And the other way that I put the wires on are little EKG patches. If anything falls off during the night, I'll knock on the door, I'll let you know I'm there, and I'll reapply it using whatever method I put it on,
Right.
okay?
Mm-hmm.
There are several wires on top of your head that will tell us your brain waves. This will help us determine which stage sleep you're in. There are two over by your eyes that will tell us your eye movement throughout the night. This helps us determine REM sleep. A monitor on under your nose that will tell us the airflow out of your nose and your mouth. This will let us know if there's any pauses in breathing. Two on your chin that will tell us your muscle tone. This also helps us determine REM sleep. Microphone on the side of your neck that'll tell us if you snore. Two EKG patches that tells us your heartbeat throughout the night. Two belts, one across your chest, one across your stomach. This will let us know where you're breathing from throughout the night. A monitor on your finger that will tell us the oxygen level in your blood throughout the night. And last but not least, two EKG patches on each of your legs. They'll tell us if you kick around during the night.
Right.
Okay?
Mm-hmm. So most things that you would find from this kind of a test, I guess there's a wide range of things you will
Well,
find.
there's many
A
forms
lot
of
of them
sleep
would
disorders.
be, yes, would be treatable and would be.
They're all treatable. All forms of sleep disorders are treatable. The majority is sleep apnea. It's 85% of our patients
Right.
have sleep apnea. All forms of sleep disorders are treatable.
Thank you.
That's the majority.
Mm-hmm.
We have periodic limb movement syndrome, narcolepsy, night terrors, and other forms. We test for everything in one night, so you don't have to come back again.
And would you say that a lot of people probably don't realize how much some of these sleep disorders could actually affect their life in their waking state? They just sort of.
The majority of people never realize
Yeah.
how much. But once they have it corrected, they feel 100%
Makes a
better.
big difference, yeah.
The lab is open 7 days a week, and
Oh.
most patients come in, have a sleep study, and go to work the next day.
Mm-hmm.
They can shower, go to work the next day.
So for you, Sandy, is it like an all-night shift? You're
Mhm.
basically up the whole time?
Yes.
And then
yes.
you get to rest during the day, I guess, when you're doing these? Do
Absolutely.
you do this pretty regularly, or
I work 3 nights a week.
3 nights? Mm-hmm.
One of the advantages of going to a hospital for a sleep test is we have number one, the best equipment, and also I think the best trained technologists, and we're held to a higher standard. You know, we have inspections by Joint Commission, Department of Health, which a lot of sleep labs don't have.
So it's part of the hospital accreditation, I guess, which
Absolutely.
comes right under the same thing, yeah.
So if you like to watch TV, if you like to read, whatever you like to
I'll
do.
just read now,
Okay.
and at some point I can just fall asleep, I guess, if I
Absolutely.
wanna fall
If
asleep.
you like to, if you do fall asleep, you could turn off this light, or
Okay.
if you fall asleep with the light on, I'm just gonna leave you be. I'm not gonna come in and turn off the light, because usually that will wake you up, okay?
It won't wake me up, nothing will wake me up.
Okay, and,
All I ask is there's a fire and the walls start coming down, just remember that I won't wake up unless somebody
No,
comes in
no, I'll
and
catch
drags
you,
me out
don't you
of there.
worry.
Okay.
Okay, if you need anything, just give a holler, like I said, I
Okay.
should be right in,
Okay,
okay?
well, thank you so much.
You're
It's,
welcome. Would you like me to hand you your book?
Yeah, it's right there, the Kindle there.
This?
And, no, this is the book
Okay.
and the glasses,
Glasses.
so that's fine.
There you go, okay?
Yep,
All right, well, have a good evening. I'll
yes,
see
thank
you
you so
later.
much.
For a consultation, call the Riverview Sleep Disorder Center at 732-530-2314. Riverview Medical Center, with 2 convenient locations. 1 Riverview Plaza in Red Bank and 100 Commons Way in Homedale. Call 732-530-2314 or log on to riverviewmedicalcenter.com.